You need to know, of course, when you're going in here whether you need a visa. Mali does require a visa to get into the country. Very easy to get. As far as Mali, we had a government contact there that was able to get those for us pretty quick. So, embassy contact and registration. You need to register with the State Department, which is an interesting thing for us because the State Department warned us not to go. A couple of different years, we actually sent 2 people over to Mali to meet with the U.S. Embassy, and they told us, yeah, contrary to what the State Department is saying, it's fairly safe in this area, so you need to you'll be okay. But at this point, it's such disarray. I don't think I'd go against State Department warnings again. So registering the State Department is important because if something happens to you, they know kind of how to help you, and they're a lot more. They'll facilitate things a lot better, from what I understand. Vaccinations, if you got them all done, yellow fever card, malaria, those kind of things. Usually the county health department. Got to make sure you have all your shots. Customs issues with the medical supplies, some notes in the luggage, as we've stated before, about what this equipment is. We had, again, contacts with the government. Was one LDS person that's in Mali is running for president, had a lot of contacts, so they actually skipped customs for us. We just skipped them right through, so kind of an interesting thing in Mali. Electricity, one clinic we had electricity, the others did not, and it was 220 volt, so you have to be aware of that and have conversions and whatnot. We had places to charge fuel, things like cell phones, but you get out in these villages, there was no electricity. Hence, they would put in the solar panels to get electricity for these schools so they could go to school when it was dark. Sterilization, disinfection, there's no real sterilization over in Mali. You're putting it in Clorox and different things, trying to get as clean as you can get, and go through a series of tubs, and you just do the best you can. Not much of an issue, by the way, in Mali with AIDS and that kind of stuff, which dies pretty quickly on contact with air and whatnot. But anyway, there were sterilization. We just did the best we could. Luggage delays were lost. We did lose luggage on the way home one year. We lost luggage we never found ever. Anyway, but this last year we lost 2 pieces on the way that contained surgical instruments for 2 of us, 3 of us. So we were sharing a lot of instruments and trying to make do with that. So this, again, you just have to roll with that and figure it out. A lot of things happen. You've got to be ready for it. We found that having a post-trip party together, get everybody back together again, and find a way to share photos, and everybody copies their photos, and we hand them all out. We make 8 copies per person or whatever it is for families, and they distribute that at the last party. So anyway.
And in conclusion, this was our group, and to kind of give you an idea, you can kind of pick out the white folks that they were the ones we took over. But all these boys down on the bottom row, for example, were all of our interpreters. The guy in the white shirt actually volunteered to come from the embassy, contacted us and volunteered to come. The guy in the far right, on the bottom, the far right in the lime green shirt, his name Drummond. He was my interpreter, and I am still in contact with him. Marvelous to have contact with these individuals. Ibrahima is standing next to me in the orange shirt on the back row, and he's coming over to visit. So all of these people are involved in order to make an effective trip. And any of those, that was the van, we had 2 of those buses and vans that we just piled way high with luggage on top in order to make it go. So it's quite an adventure, no question. In summary, tremendous opportunities, as all of these are, and you kind of have to pick what means the most to you. Find something that is meaningful, that really makes your heart beat, and that's where you have to go. Get your feet wet. Don't be afraid of doing something like this. This is a pretty aggressive trip. It's not necessarily something that you just start out and do, but it's kind of a baton pass, and a lot of these are that way. Someone else has run the first lap. They may have run the 2nd or 3rd lap, and now you're taking a baton and running the 3rd or 4th lap, and beyond that. So build on the successes and the progress of someone else who's gone before you, or in some cases, find something again that really motivates you, and start from scratch. It really can be done, and it's a tremendous experience, as you know, and as you've heard others talk about. If you haven't done it, it's really a tremendous opportunity. For me, this is very meaningful. This is a painting by Liz Lemon Swindle. I don't know how you're I don't know if any of you are familiar with it, but for me, this is one of the reasons. This is one of the things that certainly motivates me. You'll find that there are tender mercies that come along the way. This photograph is one of these tender mercies. I shot this. I took all these pictures, in fact, but I shot this one on our way home from the clinic one night. Those kids appeared up on that wall and were there for about 5 seconds. I turned, took this picture, click, click, and they were gone. But I couldn't have posed those kids any better. They're just delightful. This is the reason that we go. And I think that's the reason that all of us go, is to serve these folks. They are very much our brothers and sisters.
Concluding, to conclude this, we're out of time, but boy, to second what Tom said, this changed our lives, changed the life of my wife and myself and my children. It just gives you a whole new perspective. We love the people of Mali. We wish we could go back. Wonderful, wonderful people. Something did come to my mind that I probably should mention. It's come to the attention of the executive committee. You notice there were a couple of young men in here, or at least one young man and a teenager. We've had the practice of going, and we discussed this. Wayne, I had an interesting conversation after meeting last time that the pre-dental advisor, Dave Kaiser, right, at BYU, he's brought a sheet in, and boy, anybody that goes in these expeditions, what we've allowed a few of them to do, you've got a mobile, extremely mobile number 8, whatever it is, we allow a teenager to extract that tooth. We've been doing that. They're in blood all day, working with those instruments, and we thought, let's get a picture of them with this extracted tooth. They think they're pretty neat. We've got to keep in mind we're working on human beings. We've got to be careful of what we're allowing others to do. But what they've reported now is that some of these students going in to interview at dental schools, by the way, I extracted teeth during this expedition, they're done. They're not getting into dental school. So Dave was pretty firm on that if a dental student, any person that's been with you, I don't know about dental students, a little different story, but high school students, others, college, either don't allow them to extract teeth, or they better not be talking about it on the interview into dental school because it'll prevent them from getting in. That's the message we've had back, so I thought I had to mention that to you if any of you have participated in that same thing. So anyway, we've loved this trip. It's been great. Here's some contact information. And if you need to get a hold of us, we'd be happy to send you this whole thing. So,
how do you determine who you work on and where you go? Does Ibrahim do that, or is that how, so you get there, he just takes you out, and you get,
we select the villages in advance. We know exactly where we're going, these villages, through Ibrahim and others. And the one clinic that we go to in Welesabugu, that's set up. We know kind of where we're at there. They announce it on radio and different things. Not a lot of people have radio, but word does get out. So by the time we get there, one year we sat in a place on our way home in a hotel. We were on national TV. They had a story on us, filming us on national TV. So word gets out, and it gets all over. And even though not too many people have TVs, but the word gets out. So.
We also, this last year, worked through a Peace Corps volunteer who had heard about our trip the year before and relentlessly emailed one of the members of the group begging us to come to her village. They had never had a dentist there before, and we did so, and she was a marvelous facilitator. She was absolutely fantastic. Since then, they've pulled all the Peace Corps volunteers from Mali. They've pulled them all out for security reasons. But the Peace Corps, occasionally, a group like that can also be a contact to help you do that. But he would spread the word. Ibrahim would get the villages out, or the word out to the villages. One of the things that we did was, when we arrived at a village, the first thing we did was go to the chief's home and meet the chief, and basically ask permission and get acquainted with him, and then that paved the way for everything else. Generally, they just line up, and then you triage them as they would come. We would take a blood pressure on them and do a basic triage as to which teeth were hurting and where, what areas of their mouth were bothering, and then after that, I would just take them as they come, one after another. Any other questions? Okay, thank you.
Do you have questions for any of the group?
You work on many kids. clients, or mostly adults? Or?
We do work on some kids, go ahead.
Not a whole lot, but many, and that was also a nice thing to have Shane along. We had a couple of kids that were pretty apprehensive, and he could give them an IM ketamine injection, and they were comfortable, and that was really handy on a couple of occasions.
Hmm. It's mostly just the worst on a few people. I
Yeah.
mean, I mean, I know.
You know,
so you just kinda,
we would take out as many, well, there's a great joke, and I don't go into what the joke is, but we actually kept track, because the foundation kind of wanted to know what we had done. And in 4.5 clinic days, we extracted 755 teeth. And some patients, it was 10, 12, 15 teeth per patient. Other times, they were really ugly thirds with amazingly dense bone. And so, and you have no handpiece, none of these are sectioned, or so you've got to really be adaptable, and that's where the competence and the skill comes from, is that you've got to be comfortable doing that. And again, if that's not a part of your practice regimen, then this is not the kind of trip to take.
It's not where you start.
It's not where you start.
There were 6 dentists in that, and I might mention on another more spiritual note that, I mean, you hear these hand cart stories. It was like that. I mean, you didn't do this alone. It was phenomenal to see. The one day we had somebody come in and say, "What are you going to do?" There's a line of 100 and some odd people. We've only gotten one dentist had gone with my wife to the U.S. Embassy to meet with the Minister of Health. And anyway, we were so far behind. So I mean, what are we going to do? I said, okay, let's have a prayer. We finally got some patients taken care of, gathered for prayer, and it was just phenomenal what happened in the next 4 hours, and got everybody seen. And it was just, I mean, crazy things that you know would never happen in my personal practice. It was just miracles, and everybody remarked that at the end of the day, saying, wow, we could not do this alone, and we couldn't. So you depend on a higher source a lot of times here. So.
Thank you.